I was out there campaigning against rape, against marriage in the 70s as a student and so forth, it wouldn't be like this for our young people. So just have to think about that. There's a bit more infertility, and we're seeing new denials of care, things I wouldn't have thought possible in a humane society that I thought I'd grown up in. So my thoughts are going to be a little bit, because I'm a doctor on some of the science and technology, I think a lot of it's to do with people and opportunities and alliances and movements and unions and so forth, but I think it's also to do just with the simple fact of vested interest in money. And we have come a long way. I looked this up and found, even the piece of paper with a typing on an old-fashioned machine and a staple, this was something about the public health. And I come back to that as my conclusion, something to do with collectivism has been mentioned before, and public health. This is my favourite slide. Unlike Alison, I'm an obstetrician, so I start with women and from whom children come because they are not containers for the thing contained. And I think the obstetric profession is only justified for what it does in terms of saving women's lives without making them mentally ill, but we don't always manage that. And it stops in the 70s because that's about when I started, but it's the same thing that I want to say, that it's a lot of it to do with public health advances that we've seen, getting rid of sepsis, abortion, and so forth. So the technology is good, and this was a time when you can see when the NHS come in full of optimism, an issue about public health, post-war values of coming together, and that we're in it together. It takes a village to raise a child. It takes a society to raise all our children. And whether that's still going on, maybe we come up in discussion. So I'm going to just a heresy alert. I'm not talking about inequalities and race and various other things. I just want to come on a little favourite topic, but it's because it's one issue that has been the thing that struck me as I've been delivering babies and watching babies being delivered for 40 years, which is just about age. The first thing we say about someone is, this is a 20-year-old white private midwife who lives in Scotland, whatever it is. But the very first thing we say about people is their age followed by their sex. And there's some things about biology that are unchanging, even though we are healthier. And menarche, the first period has come down because of better nutrition of children. Menopause has not changed. And I think we're seeing something about women's biology that we've changed from an idea of the populations to something very individual. Somehow this is, you mentioned choice, that actually pregnancy is a choice. It's actually there's a dark side. There's a dark side of the coin of choice, which is that of the demonisation of the bad choices, supposedly. And I think you mentioned IVF, which I'm going to as well. Yes. The sort of valorisation of the technical, I can, by cycling, walking, running, taking this or that, somehow live forever, which is what's not said, but that is what's being sold to us as an idea. So just to remind you, because I can see there's some young women in the audience, most people will know that, the reproductive age range is 15 to 45, approx. The healthy normal bit is 20 to 35. That is when every single outcome is best, and that's because of a log scale fall of eggs, and eggs at the right-hand side, of age on the bottom, are not only short in number, they're poor in quality, which is why 1 in 2 pregnancies over 40 miscarries, because chromosome abnormalities. This graph is the whole of obstetrics textbook. My 40 years of knowing about obstetrics is summed up in this graph. As you age, fertility, that top one, falls. As you can see, the normal range is 20 to 35. I know women used to cry at 30 when they weren't married, and now they cry at 40 if they haven't had babies. But the biology didn't change over the 70 years of the NHS. And the miscarriage graph, that J-shaped curve, is the same for the common complications of miscarriage as the rare complications of maternal death, going to intensive care, having a postpartum hemorrhage. And although we're right down there, very small numbers of maternal deaths and very few infant deaths, for each death, there will be at least 100 women who go to intensive care, and we're seeing rises in sections, rises in postpartum hemorrhage, rises in some of the concerns about post-traumatic experiences because of some of the inhumanities and fears of dying. My mother's generation knew that they might die in childbirth. It was very frightening. But that brush with death, which is experienced, I think is a tremendous shock to people who thought when they cycled 8 vitamins and so forth, they would live forever. So, and I would just like to, my other heresy is, I don't have a problem with teenage pregnancy. I think it is oversold as the route out of poverty. I think if people have children and they fall off as women, in whichever class they're in. Richer women can protect themselves more, but what we do not tell our young people is because of the 50,000 cycles of the women who get them and can afford them, there are more people having IVF each year than there are having teenage pregnancies. For an individual 10-year-old, she is more likely to be infertile and have no children than to have teenage pregnancy. Of course, she has longer to be infertile. That was a slightly cheating figure. I'm not going to cheat on statistics, but I think this is, I don't think just teaching the basics, I think teaching discernment and lifelong thinking and how to understand a world that is bombarding you with information that is false is quite difficult. And so this is another way of showing some of the things that Alison showed, and I'm just giving you a bit of value: green, yellow, pink and red. 74, 84, 94, 2004, I haven't done the 2014 on here. Maternal age at childbirth on the bottom, and the numbers on the right. There is a massive demographic shift moving rightwards, hitting that curve of complications, which is why it is the justification for more obstetricians. We haven't got more midwives, even though the complexity, the skill mix that needed is much harder and higher. I would like more people having babies, normally younger, easily at home and in alongside maternity teams, because I think that's the best experience for them and their babies. But we're up against social change that is it's crunching into biology, and that is why we keep asking for more obstetricians. We don't know which part of the section rate is medically driven and which is driven by need, but we're working harder and harder merely to stay still. And I think you also get a sense in that last graph, the red one, of the a slightly bimodal pattern. I think we're seeing more inequalities. People who are having their children young are different from people having their children older. And, sorry, just go back. We worry about teenage pregnancy. It was vanishing well before the government pre-teenage pregnancy strategy, because if you give it the information, the children information, they will want to protect themselves from getting pregnant. But we go on demonising this end, and we haven't noticed the exponential growth of this side. And this is leading to damaged babies. Premature babies, more twins because of IVF, more twins because of age, and so on. So I don't think this is a good trend. I bet people don't care because they think it's the white and rich. It's not. It's also the section rates for someone like me working in London with more than 50% of black and minority ethnic women. I am concerned about it because I see cultural changes that the rich are driving and the doctors are driving, actually born out in the bodies of obese, older, black multips having a fourth section, that none of them they wanted, but now they're nearly 90% of previous. So that's what, it was those sorts of observations that made me think, yes, we've got these gains, but it's not right, there are losses as well. So I've told you about some of my observations and societal expectations. I think there's issues even around the sort of language we use about choice, teenage, asylum seeker. Asylum seeker used to be someone I had huge empathy, pity, concern for. Now it's something, it's a term of abuse, etc., etc. So we have to watch all those things that are going on. We train people very differently, obviously. I was taught a lot about rheumatic heart disease. It's vanished. I had to learn about HIV, a major scourge and problem in pregnancy. But again, technology and drugs have really done an enormous amount for vertical and horizontal transmission. So training has to adapt to that. Team working wasn't a concept. It used to be, the doctors who lived in the mess, which was like an officer's mess, told midwives what to do, or they thought they did, of course they didn't. But there is much more sense in a complex world that we need help from others. But team working can become very fragmented, and actually the continuity of care that is really vital for this major life transition of birth is lost. So we are losing some really important things around continuity of care and the love and care of the women in the neighbourhood, or the doulas, or so forth. Some things are coming back. I'm very worried about the cultures of learning that our young people are having, because they are taken in by pseudoscience, and women, I think, sadly, at least probably some geeky, I think are particularly innumerate and particularly prone to, my friend tried homeopathy or acupuncture, it worked for them, let's have it on the NHS. We see, for example, some of the cancer screening that doesn't work being driven by people saying, oh, but I feel the NHS cares for me if I have mammograms in my late 70s. Actually, they may kill people and they end up with higher rates of mastectomy. So I'm really anxious about some of those cultures. And I heard a civil servant the other day talking about how in the coalition, it was a conscious decision to move from evidence-based policy to what people want, because that's democratic. And I think there are two values that we have in collision, that there is expertise, and sometimes we have to trust experts, because we can't make sense of the whole of the internet. And I want to trust people. I like being trusted. I can't work without trust, and I don't want to have the bother of doing it. But I do want the people who I give my trust to earn it, and yet I don't want everything to be done on, so-called democratic whims. So it's a problem. I think maternity care lives in the context of public health, and here are some of the aligned experts. You'll see our friend Alison here, Alison McFarlane, about 2/3 of the way down. So this is an enormous number of experts who wrote a letter to The Guardian in response to a very popular and misdirected idea that we could just halve. I was talking to some of the people who were being bullied by ministers. The head of the Royal College, can you just halve stillbirths by tomorrow? No. Exponential curves get harder and harder to reduce, and they come with costs. And so here is a lot of experts writing in The Guardian saying that public health is the key to cutting stillbirths. Amongst the world's richest nations, we've got the 3rd highest rate, and we shouldn't do. We welcome Jeremy Hunt's announcement, but he thinks it can all be done through Fitbits and equipment and machines that go ping. It can't. Not unless you control women by walking around with a machine, checking up on her baby is contained, which they'd like to do at home deliveries and all through pregnancy. And all it will do is create false alarms and increase prematurity, as we saw, and not have an impact on cerebral palsy. We've got problems with prematurity and cerebral palsy because of inequalities and a misapplication of medical technology. Here are the real issues, and I think this is a call to go back to the very foundation values of the NHS. So I will give you all of those at once because I don't want to go over my time. I think we've seen inequities come and go, and new ones appear. I think reproductive autonomy is paradoxical. People think they're in control, but it's a false sense of control. Time marches on. You go into labour. I've been asked to do a debate next week. Should women sign an informed consent form to go into normal labour? So I said, absolutely fine, so long as that when you and I have sex, I consent that I might get pregnant and have to go into labour. But actually now young women, like my daughter, are having long-acting contraceptives, 5 years, 10 years, and they can't have an accident that just makes life interesting. They have to make a decision, and then they expect the pregnancy immediately, and then suddenly find they're 36 and having problems. So I think women and men are actually having a harder time in some ways, not in others, facing inequality and particular austerity, being isolated because of these smaller families. We've got less brothers and sisters, and our families are further away. Both of us are at work, grinding away, trying to earn the money to pay the rent. There are some problems, and I think that the environment which we have now got in parts of the government and some sectors as being deliberately hostile to some people who are not worthy is dangerous. Plus, moralising and women blaming, we're very used to it. All women get blamed, whichever you do, you get it wrong. So once you realise that, you actually just calm down. The best thing my neighbour said to me, I said something rather, she said, "No, sure, don't worry, whatever you do is wrong. Your child will be complaining to the psychotherapist in 20 years. Don't worry." So, my conclusion is we should go back to very traditional expert values about public health and collectivism, harness the science where people aren't making too much money, selling products like IVF that doesn't work and causes more damage to children, and it's vital to get the young on board. Thank you.